This video we're going to cover knee chest adjusting, in particular the single hand move on the knee chest. Very similar to the move you learned in full spine. We're just going to be applying that technique to the patient on the knee chest table to take advantage that the table allows us. So we're using our single hand, same rules apply as we had in full spine, but we're also going to take into account the disc plane line in Gonstead. So I'm going to make sure that I line up my episternal notch in the disc plane line for every setup that I do from C2 to L5. So we're going to do an L5 PLS listing and take our tissue pull with our opposite hand, inferior hand to the fleshy pisiform, lock it into the posterior inferior lateral aspect of the spinous process. Going to stabilize over the pisiform, not a general stabilization here, but focusing over the pisiform. I'm going to use my knuckle or pistol grip over the pisiform. I'm standing straight away, the segment's pretty much centered on my body, and I'm going to lean a little bit in superior to the patient to put my episternal notch in the disc plane line. So when I drive with this impulse, I'm going to bring the patient to tension, and I'm going to set and hold. The reason why I want to put my episternal notch in that disc plane line is because the adjustment will be an arcing motion. It's not going to be a motion straight P to A, and it's not going to be a motion straight S to I. And you're asking, why do we go S to I on an L5? Because we're going to initiate the adjustment to facilitate the facets, which are in this plane. We're going to open up the facets, and as we're opening up the facets, pushing P to A, we will then drive through the disc plane line in the S to I direction. So that adjustment will have an arcing motion. It'll look like this when we deliver it, okay? Now we're going to go to L1. In a typical lordotic curve, L1 will now have an I to S disc plane line. So I'm going to take my episternal notch, line it up with the disc plane line here. 5, 4, 3, 2, 1. Take my tissue pull, secondary tissue pull with my fleshy pisiform. Let my fingers go across the spine. Move my episternal notch a little bit inferior, and then stabilize. And the reason I want that episternal notch here is I will do a little bit of a body drop as I sink in, and I'll set and hold. That body drop will help you direct the force through the segment and through the disc plane line. If I just line up straight away on the patient here, and I try to do that I to S, it's almost like pulling the hand to the side. Here, I'm going to center that segmental contact on my body, so when I'm pushing, I can do this motion and use all of my strong muscles and coordinate them equally. Okay? We're going to move up to T1, 2, 3. This again will switch to an inferior hand contact. And for the simple listing, I will just let my hand rest over the back of the patient's cervical spine. I'm on T2, PLS. And typically at T2, there's an S to I disc plane line. So I'm going to rotate my torso so I could lift and set. Lift by opening the facets, I to S, and then set through the disc plane line. So there's more of an arcing motion to that. When I'm in the upper thoracic spine, it's going to be very difficult when doing a rotatory listing to get my hand to get into the position it needs to, because it'll be resting on the back of the patient's occiput. So what I'm going to do is I'm going to rotate my fingers around so they rest and wrap around the patient's trap on this side. TP contact, PRI listing on the TP on this side, on the left side. Rotate my shoulders just a little bit. Make my stabilization. A little bit of S to I for my disc plane line. Follow the patient down. Set and hold, and then slowly release. That is what single hand looks like for the knee chest table. I'll see you on the next video.